Hi, this is Dr. Fredrick Peters, the Fitness Doctor, and thanks for watching. Today's episode is how to eat and train for your specific body shape, whether it's pear shape or apple shape, a larger midsection, larger upper body. You can actually eat and train to help fix those problem areas. And while you cannot spot reduce, you can actually focus on certain kinds of body fat, whether it's subcutaneous fat or visceral body fat. The first shape I'll look at is the pear shape. And that's where you have a larger hip, thighs, buttocks area. The problem here is subcutaneous fat, and that's the fat that lies just below the surface. And it's hard to get rid of, it really is, but there are certain things you can do. The first thing you can do is eat a low-fat diet, specifically a low-saturated fat diet, avoiding things like red meat and just meat in general, also cutting down on dairy, especially high-fat dairy, and also getting rid of things like coconut oil that are just loaded with saturated fat. What you actually want to try to find are alternative sources of calcium, because calcium actually changes the way your fat cells store and use body fat. Alternative sources include kale, include almonds, and even non-dairy based yogurt like almond yogurt or cashew yogurt. That's one thing you could do. The second thing is circuit training. So to help reduce that pear shape, that subcutaneous fat shape, circuit training, where you alternate between cardiovascular exercise and strength training and go back and forth, that's a great way to help reduce subcutaneous fat. It'll increase lean muscle mass, it'll also help boost metabolism, and it actually reduces the appearance of cellulite. Number two, the apple shape. Someone that has a larger belly fat region, that's really not healthy. The visceral region, where you have extra central adiposity, well, that's where all your vital organs are, and you really want to keep that area as slim as possible. It's really the battle of visceral fat. It's linked to type 2 diabetes, it's linked to heart disease, it's linked to cancer risk, and one of the biggest culprits here is cortisol, because excess cortisol is stored in that visceral fat. That'll slow your metabolism down. It'll increase the reduction in lean muscle mass by breaking down muscle tissue. So one of the things you can do is you can adopt a diet that basically is low refined carbs. So getting rid of things like processed sugars, breads, pasta, rice. You want to avoid refined carbs. However, unrefined carbs like whole grains are fantastic for this issue. The reason being is that these carbohydrates that whole grains like brown rice and millet and quinoa and amaranth and buckwheat, they have a insulin buffering capacity. So when you eat things like oats, for example, for breakfast, the oats themselves will actually act as a buffer to reduce insulin spikes throughout the day. And the insulin spikes are a big problem, because that's what's going to actually help you or cause you to retain additional visceral adiposity. Also, anti-inflammatory foods like olive oil and salmon, they're great for reducing the larger middle visceral fat body type. As far as training goes, you can focus on interval training, specifically high-intensity interval training, where your body shifts from anaerobic to aerobic in terms of oxidative utilization. And you do this by, let's say on a treadmill protocol, having 30-second bursts where you're going really, really hard and then recovering. And those peaks and troughs in your heart rate actually help to increase your metabolism and decrease belly fat. So that's today's episode in terms of the two body types that are the biggest problem areas and how to eat and exercise to help fix those problem areas. Thank you for watching, and I'll see you tomorrow.